Hello and welcome to Meet Your Inspiration podcast with Meri and Rich. Here we're talking about inspiration, motivation, and empowerment. Our guests are ordinary people who became extraordinary, and with sharing their stories, we want to encourage you to become the person you want to be and to go beyond your dreams.
Today we have our special sponsor who is sponsoring this episode, which is What's On in Kent. This is an application and a website which you can find online, and you can download the app for free. What's On in Kent is able to show you places that you can go out in Kent, whether it's events, whether it's hotels to stay and restaurants and other things which you can find going on around the county. If you would like to find that, or you'd like to be involved, if you're a restaurant or a hotel or you have an event, please do contact us and we can share all the information and get you set up on the app. So please contact us if you can. So we'd now like to welcome Ivanka, who is our special guest today. Dr. Ivanka, and I'm going to try and get the pronunciation exactly right. Ezhova, is this correct? Perfect.
Perfect.
So Ivanka, would you like to just tell us a little, Meri, first of all, you're going to do the introduction. Sorry.
No, I will do a little one, as we like to say to our listeners and our audience, a little bit more about our guests. And I think our story, Ivanka, is really cool because I will leave you later to say about all your titles, because I'm pretty sure I'm going to mess up somewhere. But definitely you are a psychotherapist. Am I right?
Clinical psychologist. Actually, the right title is clinical psychologist. I can explain the difference later if you will.
Okay. So back in, I'm going to be wrong for sure, but it's definitely after 2010.
Yeah, it was 2016.
Wow, really?
Yes.
Okay.
Yes.
That was long time ago. I don't know at all how I land on your Facebook page. Back in the time, you had a really nice Facebook page.
It was called, I think at the time, Positive Psychology Network. That was the very first name of the Facebook page, Positive Psychology Network. Now it's Dr. Ivanka Ezhova only. So yes, Positive Psychology Network was the very first name.
And I don't ever remember how I end up on this page, but this page changed a lot about in my life.
Thank you.
And most probably you don't know, but you did play a role in my transformation and lots of things that I changed in me. Because I had a really young boy back in the time. And I remember I was following you on the page. I really like everything that you were sharing. And there was an event you organized in London, which for me, it's not far away, but having a little one was really a bit difficult to go for a day in London. And I absolutely was convinced that I have to do that. So I found out who will look after him. I jumped on the train, and that was a trip that I still remember. Being in the train, I was talking to myself, where I'm going. I don't know anyone, because I didn't know any one of these people. I never met you in real. It was just a trip that I don't know where I'm going. We met in a nice place where we had a coffee with lots of other people. And this was a great meeting because I never ever been to an event that after that you took us to a beautiful gallery. And we were going around and you were telling us about the different arts. And we were, honestly, it was amazing. Then we were crossing one of the bridges. I don't know which one was, but I remember how people were engaging and talking. And we end up in a Lebanese restaurant, if I'm not wrong, which I love Lebanese food. And there as well, other people joined, and we had such an amazing time. And I couldn't believe that I've been so much out of my comfort zone back in the time. And I met all of you people. I needed to leave because I needed to catch up a train, go back. But this is a moment that is in my heart. And you remember, I'm pretty sure I always remember that. Years later, we somehow, you will tell us a bit later, but somehow we kind of lost connection just because obviously you were going through different things in your life. And was this year, few months ago when on that page come up and you were back. And I clearly remember my reaction. And I was like, oh, you're back and this is how we connect. And a few months later, you are our guest. And sorry, honestly, emotions kick in without even think about it. But yes, I'm really pleased to see you here and to welcome you to the podcast. And I'm looking forward to this episode because you are incredible.
Yeah, thank you. You're going to make me cry, Meri. So, I'm getting emotional too because it's such a lovely and sincere feedback. And you know what? I have never realized that I impacted. It wasn't me, it was the event and the people there. I remember where we were and, it was yesterday. And I have never realized that the event has impacted you so much until now. Wow. Thank you so much for sharing.
And
Thank you
not
so
only
much.
that, you had back in when people haven't done that. I remember you had like daily posts which were very encouraging, and probably they just came for me in the right time. But yes, this is why as well doing this podcast, we want to share and to tell people that very often we are touched by others or we meet people on our journey that we don't realize at the time that they are playing a big role for us. They are having impact on our life. And later on, when you turn around and turn back and you see, and we start to realize. And for me now, that's why it's so powerful and important. And my emotions kick in because back in 2016, I would never think that we're going to sit like that and we're going to have the podcast and all this that is going behind the scene, the lovely messages we get each other and starting to learn a bit more each other is just magical and I love it. And yeah, this is the purpose of this podcast.
It really is because it touches people's lives, doesn't it? I mean, how we inspire and touch each other, it really makes a difference. Ivanka, can I just ask you, because you've got such an interesting background and obviously it must be a fascinating journey because, I mean, you're currently in Bulgaria. Are you in Plovdiv at the moment?
No, it's a little village, a small village near Pazarjik, which is something like 45 minutes driving from Plovdiv, I think. And actually, I grew up in this small village, and it's a very interesting story because this village and the house where I am in for 20 years, they were a symbol of trauma and lots of difficulties, and I needed to extract myself from here. I needed to work on myself, to progress on myself, on my own. And when I felt ready, I thought I'm going to go back and I'm going to rebuild. I'm going to rewrite my story. And this is what I'm doing today. So you see me in my actually family house. And I'm rewriting a story, rebuilding my relationship with my dad, for example, reconnecting with friends here in Bulgaria, but also I'm connected to people all around the world. And it makes sense for me right now.
So you've been all over the world a little bit. So you've met a lot of people. So how did you start? Because you're currently a psychologist, clinical. So how did that start? What drew you to sort of wanting to get into the analysis of psychology?
Yes, I'm a clinical psychologist. That's the title, but people don't know the difference very well. So let's say a psychologist. And I remember I was a little girl, 5-6 years old, and I remember observing people's behaviors, my mom's behaviors, because my dad he lived abroad for a while in Moscow, in Russia, because of the economic situation of the country. So my sister and we were raised by our mom, and then I was exposed to her behavior. So she was my first role model and the person I was observing the most. And then it was very interesting. I remember wondering, is it a normal behavior? What is my mom doing? Very bizarre questions for a child. And then I started to observe my teacher's behaviors or my friends' behaviors. And from a very young age, I'm having this interest towards how people behave, why. I really want to understand. And now I want to help people. For example, when I see something, I talk to people. It has always been very interesting to me. And I remember when I was 11 or 12 years old, I heard about Sigmund Freud. So for me, Sigmund Freud is the father of modern psychology, even if, many people don't like him because of his theories, very controversial about sexuality, specifically child sexuality. But for me, it was so interesting. And I read this book, 3 essays on the theory of sexuality. I think it's the English translation, and I loved it. So I thought, oh, this is what I want to do. It's so interesting. And at the time in Bulgaria, then Meri, maybe you can help me after secondary school. It's the high school, right? Where we are choosing actually more of a specialty. And I decided to go to a French high school, or it is called bilingual high school, to learn French, because I learned that France, it's one of the biggest centers in the world where people study psychoanalysis. So for me, in the very beginning, I was more interested in psychoanalysis, Sigmund Freud's theories, rather than psychology. And I remember, so in Bulgaria, to this transition between secondary school and high school, it's very competitive, and there is an exam, and I was very good. I always, I'm one of these people who, spend their lives reading and writing. And then I was accepted in the most prestigious high schools in Patarjik, which is the town near where I lived. And my dad said to me, I want you to study economy. And because language school, it's not something that will give you, it's not interesting for you. And then you have private lessons like English. But I thought, I really want to learn French, and I want to go to France. And then at the time, my dad left for Russia because he, at the time, and there was a lady looking after her. At the time, my parents divorced, but that's another story. And I said to the lady, look, my dad said to me that we are going to the French school, the bilingual school, and this is where I'm going to study. And that was my choice. Then when my dad, I remember like a few months later, he was back to Bulgaria. He said, what did you do? What is this? And I said to him, I want to study French, and I'm going to France. And then he was okay, but it was really my choice. And then this bilingual school, or we can call it French school, opened the doors to the world to me. And
Ivanka,
yeah.
How old were you at that point? What age were you? 11, 12?
Yes, 12. I was 11, 12 when I heard about Sigmund Freud, and I read this amazing book. At the time, actually, my understanding, because I read it again in university, and I thought, oh, my understanding is very much different. And then the French school, I think I 15, was 14, 15.
Yeah.
Is it?
Yeah,
15?
Something like that should be, yeah.
Yes, I think it's 15, and yes, 15 to 18, and then we go to university. So yes, I think 14, 15, where I really made this choice behind my dad's back and wishes for me. And that was, I think, the very first big choice in my life, followed by a lot of other big choices, the right ones, always the right ones.
So at that point you were speaking already, obviously Bulgarian was obviously the native language, but obviously you were speaking a little bit of Russian because your father was obviously from Russia, and then a little bit, and did you English as well at the same time?
No, I don't speak Russian. Actually, my dad is Bulgarian. I think that we have a Russian granddad. It's a little bit a very bizarre story, but I was born in Bulgaria. I don't speak Russian, even if it's, for me, the most beautiful language on earth, and I never have time to learn it. I have started so many times. Anyway, so my dad worked in Moscow in Russia. It was mostly because of the economic situation in Bulgaria in the early 90s. And at the time, I think that Bulgarian is my mother tongue, and then my English level was amazing. I was able to watch TV, to read books, and but then English was not okay for me because England, it's not a center for psychoanalysis. So I thought I need to learn French. That's my country, that's my language, and I want to study psychoanalysis.
Mm-hmm. So how you went to France then? What happened? You finished Bulgaria the study and?
Yes, actually, this high school at the time enabled people, I think it's the same right now, enabled people to get a visa because it was in 2003 and Bulgaria was not part of the European Union. And I was able to get a student visa and to go to France or Belgium,
study.
Yes, to study. And this is how it happened. And I knew that, and I thought, this is how I'm going to get the visa. And then also I needed the certificate because to be able to study in France, students need, I think it's a B2 level, or it's like a specific certificate, and only this type of bilingual schools were providing us with this type of certificate. So that were my keys, the visa and the certificate to actually go to France.
Did you find it easy for the language? Was that easy for you to learn the language?
Absolutely. I love to learn, actually. And French language, it's such a nice language. The first year was difficult because in Bulgaria, and Meri, you can help me. It is called like year 0. Actually, we do 4 years plus one supplementary year, which is only studying the language. And we spent day and night actually learning, because I remember at the time, every day, every student needed to know 50 new words. So you imagine it's every day, which means 250 words every week, and we needed to remember. And it was very stressful the first year, but again, I love to study, and it was not difficult for me. And then my dad was proud of the time, my family as well. So I wouldn't say it was good. Studying was good. Then people, I didn't like them at all. They didn't like me either. It's another story, but studying definitely was really, really good.
So where did you decide to go in France? Which university place you chose?
Definitely Nice, because again, in France, there are 3 universities very much specialized in psychoanalysis, one in Paris, one in Nice, and one in Marseille. So I decided to go to Nice because it's like a postcard. I thought, oh my gosh, it's the French Riviera, and I really want to live there. So I know that maybe it's a silly choice, but that played the role, thinking the sun and the Riviera. So yes, definitely Nice. That was my first choice. Marseille, the second choice, and Paris, third choice, because we needed to have 3 choices. But I was thinking, I want Nice, and actually I was accepted in the University of Nice.
So what happened once you obviously get to the plane, go there, don't know anyone? Obviously you had the good privilege that I'm pretty sure by then the language was absolutely on a great level. But what it is actually to get in France and start speaking French with the people there?
It's terrifying. It was so difficult. And I remember my grandmother, I'm called after her, my grandmother Ivanka, who is my paternal grandmother. I had just 2 suitcases, like 2 small suitcases. And I used the bus at the time because it was cheaper, in 2003. Flight tickets were so expensive. So I thought, let me go on a bus. And I remember my grandmother, sorry, I'm going to get emotional, just, waving.
We are real here.
And just waving at me, saying, I'm so proud of you. And you're going to succeed. She always believed in me. Sorry. She passed away in 2010.
Oh.
And I remember her always giving me money, like we were 5 grandkids, and I was this one just coming, like a drug dealers, this Bulgarian grandma.
This is a Bulgarian, just to bring people to know, and Richard as well. Yeah, usually the grandparents always love to support, and doesn't matter that they're having really small amounts of money, obviously, with their pensions. They always have something on the side for their grandkids. So these are priceless memories, and the good thing is that, yes, she saw you, and I'm pretty sure she saw your success as well. So this is the remark. This is, fantastic.
Amazing. Really touching.
By the way, just to tell you that I came in England by bus as well. The first trip was by bus as well.
Awful trip. And Grandma Ivanka with 20 left, which is nothing, 20 left, it's nothing, but with her big smile. I stopped talking about her because I loved her so much. I was caught after her as well. So yes, it was terrifying. Actually, I think that I traveled late compared to other people from this high school, and actually they waited for me there. And I'm very grateful because I think it was more difficult for them than for me. They found like a small flat that we shared in the first time, but it was terrifying because you get there and it's a different world. Actually, coming from Bulgaria, you're thinking where I am. These people and the French Riviera, it's so beautiful with these big cars and people very well dressed. So I was thinking, oh my gosh, no one will speak to me. This difference triggering all these problems with self-confidence, self-esteem. For me, actually, then people were so amazing. I started university 2 weeks after I arrived, and I met fantastic people, international students and French students, and I got friends with this lady, Emily. Actually, we were both born on 17th of March. Very bizarre. She was like 3 years older than me. And she said to me, oh, I have a car, so let me take you, and I'm going to drive you. And so nice, you go there. And I was quite rejected by people in Bulgaria in this high school. And then I go to France, it's terrifying, and I see these people opening their hearts for me. It was amazing, terrifying, but also amazing, very deep experience. And university was fantastic. I was not able to understand only one professor from Belgium because they have a terrible accent where they speak French. Nothing against Belgian people, but it's not like French language. French people speak, So I was like, what is he talking about? It's a very weird accent, but actually I was able to understand all the other international because we had some lecturers from the United Kingdom, from the US, but the Belgian guy, what an accent. So to answer your question, I didn't have any difficulties to understand and then I realized that this high school, because Patricic it's such a small town, in Bulgaria, but actually our teachers prepared us really well. And there is one teacher, she's called Vanya as well. She's now retired, and Vanya was amazing. I'm so grateful to her because I thought she prepared us so well, just so well.
And once you finish, we know that you had a career in France. How does it work? And obviously, share with us what was difficult to find work. Have you had these thoughts to come back in Bulgaria, or you wanted to start your career there and to discover more and more about this subject?
Yes, I'm going to answer now, but before that, Vanya Karanikolova is the name of my teacher. Plenty of love if she's watching, because she's fantastic, and I think because of her dedication and hard work, I was able to succeed. She was a big factor. Of course, all the other teachers, but she was the French teacher. So plenty of love for Vanya Karanikova. Studying psychology in France is very difficult, and finding a job it's almost impossible because of how the health system actually it's organized. In France, it's very different compared to the United Kingdom and to the United States. In France, it's a master's degree. So there is, it is called licence. It's like a bachelor almost. It's a little bit different. It's 3 years. Then we have 2 master's degrees, Master 1 and Master 2. And then, so this licence, it's not that difficult actually to get it. Master 1 is okay, but then it's very competitive actually to be accepted in Master 2, because I remember we were 880 who started to study psychology, and in Master 2 we were 11.
Wow.
Just to tell you how difficult it is. Usually they have like 20 or 25 places, and I remember at the time, I don't know why, the professor responsible for the masters, he decided to take 11 people only, and then we were 11. So it's very difficult. Many people actually, they have a master's degree in psychology, but because they don't have the second master's, they can't call themselves psychologists, because it's similar to the UK. I can't call myself clinical psychologist. It's a title given by the country. You know, there is a registration number. It's like nurses and medical doctors, and we can't use the title until we are registered and we have a specific number, and then we can call ourselves clinical psychologists. In the United Kingdom, it's very similar. So it's a title given by the country where you are able to practice this profession. So when I was awarded with this title, also the fact that you're awarded with the title doesn't mean that you're going to find a job quickly, because in France, it's so much difficult for clinical psychologists to get a job. It's simply because in hospitals, but also mental health institutions, there are just a few places. For example, imagine like a very big hospital. I worked for 5 years in a cancer center before I moved to the UK, and it's like a very big cancer center, and we were 3 psychologists only for, imagine, hundreds or dozens of medical doctors and nurses, and only 3 psychologists. And I think that this profession, it's not very much valued in France. Unfortunately, even if there is a need for it and people need it a lot, and because of it, many of my colleagues who graduated, so imagine they did all this hard work, they were accepted in the second master's year, and it's a very difficult one as well. And then they are not able to find a job, and very often people, they transition into something else, because it's also very difficult to build a private practice in France. It's because when people see a psychiatrist, the equivalent of, there is, maybe you can help me, the insurance, or like people are reimbursed, you know, when they pay for the session, then they're reimbursed by the equivalent of
like an insurance company, like
yes,
medical insurance.
Yes.
Yeah.
Yes, and the universal medical insurance, it's not expensive. I think that people don't pay a lot, and very often it's covered by the employer, so it's not something that they need to pay for. And that's why they will see psychiatrists, because psychiatrists also specialize in psychotherapy, and they do the work of clinical psychologists. And people think, I'm not going to pay out of pocket to see a psychologist. I'm going to see a psychiatrist because I'm going to be refunded. And this needs to be changed. And I know that it's an eternal fight, you know, coming from my French colleagues, and they are right. That's why you're stuck, basically. You graduate and you're stuck. It's a very sad story.
Explain us a bit more what you were doing obviously for 5 years there, what was your job exactly? Because I think this is a really big subject to talk about, and people very often get not sure what it is about. What was exactly your work?
It's a very good question. You're right. People don't know. So for me, it was a little bit different because I spent 5 years in a very big cancer center. But so 2 years, I was an intern, and then I worked as a clinical psychologist. But again, it was different because I was awarded a very prestigious fellowship. And as part of this fellowship, I had very specific responsibilities. So I was doing clinical work, and I'm going to explain what it is. That's the standard duties and responsibilities of a clinical psychologist. But also I worked as a researcher, and I was teaching medical students, and I was also providing training for my colleagues, like nurses and medical doctors. So for me, it was different. Usually what psychologists do in France, it's very different from the United Kingdom. I can explain after that for the UK, but in France, it's providing psychological support. It means that if you work in a hospital and here the patient, unfortunately, it's patients who have cancer, they have their cancer treatments, and at some point, their oncologist will think, oh, they may need a psychologist, and I'm going to refer them to the clinical psychologist in the center. Or another route was, it is called coordination nurse, and the coordination nurse in the hospital, Fabienne Boisson, it's like my sister now. She's one of my best friends, so that's another story. And when Fabienne, so these coordination nurses, they see the patients in the very beginning, and they are the people explaining to the patients and their families everything about the treatment, what they will expect, also life after treatment, because it's a different story. And then they were saying, we have 3 clinical psychologists here. You can contact them if you need them. So this is how it was working, either referral by an oncologist or a nurse, or people contacting us. And then we were visiting them in their rooms, or whether they were having chemotherapy or surgery, and providing support depending on their needs. And what you both will find, and I think everyone will find very interesting, is we needed to provide them with support relating to their cancer treatment, but that was the top of the iceberg, because traumas and reactivation of childhood trauma or different difficulties, and then it was very complex because we needed to provide support relating to the treatments, and then for everything else, including the family, because families were as affected as the patient.
So I guess at that point, when anyone's sort of facing it's an instant trauma, because as soon as you're told something, your mind goes into a form of shock. Yeah, and the family around you go into a form of shock, and it's how to deal with that situation. Obviously, particularly with cancer. I mean, years ago, whenever anyone was diagnosed with cancer, everyone was like, the next question was almost, well, how long have I got? Whereas today, it's not quite the same. You need to understand, obviously, what it is, the type, and whether or not it's curable or not curable, and how the chances of survival are, and things. So, obviously, to understand that, and so it's like the psychology of it is obviously clear to help us mentally get stronger. Are there many branches of psychology, Ivanka? Is it all about trauma, or what are other areas?
No, not at all. So trauma, it's one topic belonging to clinical psychologists. Then there is social psychology, organizational psychology, developmental psychology, neuropsychology. There are so many branches. So what happens in France is, during this licence, the first 3 years, we learn everything. So it's a little bit of everything. And then, when you have your license, you know nothing about psychology, because it's just again scratching the surface. And then the master's, it's supposed to give us our specialty. This is where we choose actually what we want to do, whether it's clinical psychologist, and there are many divisions within clinical psychology as well, like child psychology, or people working with elderly people. So it's very complex. Clinical psychology is such a generic area. Yeah.
So I guess, sorry.
Yeah.
Sorry, Meri. Carry on.
Yeah.
Okay. So I was going to say, so obviously we talk about clinical psychology. Obviously you mentioned about for example, with cancer, with the trauma around cancer. And I was thinking like maybe people after they've had an accident or they've lost a limb in an accident, that's another area where there must be great trauma. Are there many others that are really affected under clinical psychology?
Oh, absolutely. There are so many aspects to it. So there is trauma, of course, but also trauma, I think, is the foundation of everything, because everyone at some point in their lives has been through trauma or difficult events. I can give you the definition of trauma. People are surprised to hear it, because trauma doesn't only refer to these major events such as cancer diagnosis or a loss, or it's also minor events, some words that people don't understand, some difficulties. For example, someone was maybe not bullied in school, but rejected by their friends, and this may be traumatic as well. So trauma is an event or situation. Sometimes it's a continuous exposure to many situations or specific behaviors of a parent or someone. So it's situation, event, or exposure that creates a situation that people don't understand. For example, something happens and people can't understand it. Very often they misunderstand it, and they create a very distorted vision about the world or about themselves. For example, someone who was bullied in school or rejected in school, they started to believe that they are not perfect, that they are unlovable, which is very distorted vision about themselves. But also, maybe they started to think the world is not a great place, or people are not great. I need to be vigilant. People are not good. So this is trauma, when people develop a very distorted vision about themselves or about the world or others based on situations that they misunderstand.
With this example exactly, I believe nowadays lots of people are going back to the past, and they start to realize about some impact as well. Recently, I've seen another video of you, which really take me back, and you think like it wasn't my personal, it's not a family wise, but like, and I wouldn't say bullied as really bad bullied, but there were things that I've been taught when I was young from the kids in neighborhood, which for years and years, and probably they still stuck me, and I've got some different view on myself just because of this. Are there people that are opening and coming and trying to find help, and they're realizing that they need to, I don't know even how it's correct to say, to work on this and to get over this? How you get it, people nowadays, are they getting a bit more open to talk about that and to find right people like you to help them?
Meri, such a good question. So the majority of my patients are based in London. I worked online with them, and they are people from England, from the United States, people from China, Hong Kong, and they come and they say to me, for example, I'm struggling with anxiety. For example, I can't talk in front of an audience, or I have OCD, or I don't feel confident, and I think that this is because I experienced some events in childhood. It's like people know it, this intuition, people feel it, And even if they come with a specific need, that very often it's work-related or relationship-related, they know that there is something underneath. And I work with an amazing protocol. It's a CBT, cognitive behavior therapy protocol, that I mixed with psychoanalytical techniques, enabling people to discover the triggers. And the triggers is their past, actually, these events and situations and exposures that caused the trauma. And then once we know that, once they discover that, I like to call it having access to the bigger picture, then we can link it to the problems they experience in the present moment, because initially they come for these problems. It's all linked, and it's very interesting. In Bulgaria, it's different, because Bulgarians don't talk, especially Bulgarians who are our age, or imagine our parents, our grandparents. It's like, oh, it was difficult, but then it's not something we talk about. It's a taboo. We hide it, we brush under the carpet, and people don't talk. They are ashamed to talk. I have people there, and I realized when I activated my page this year, it was in August, and I don't know whether you've noticed, but very often I ask people, towards the end of the videos, I ask a question and I invite them to share. The majority of people contact me via personal message, and they say to me, oh, I realized watching your videos that I'm very traumatized. But actually, it's like they have never known it. Resistance, negation, denial, minimization, very powerful defense mechanisms. But they say, oh, I'm writing privately and I'm asking you for help because I'm realizing, but I can't talk about it. It's cultural, related to our childhood. And, if we start to analyze it, and maybe you can tell about you, but in my family and my friends' families, we were not allowed to talk. We were not allowed to even express emotions. And I remember not feeling well and going in my room, isolating myself. I didn't have a choice. And this is how people develop isolation, negation, withdrawn, defense mechanisms, very powerful. Also very much involved in development of depressive symptoms. People don't know it. And then you're thinking, oh, I feel depressed. I don't know why. This is why one aspect of it.
But this is what I think when I was growing, I think it was very popular in America, in American movies, all this, that people go and pay to have a psychologist to go and share the stories. At some point, I was thinking, if I don't go and study my travel and tourism, if I not accept it, I'm going to go and do psychology, because I was finding it really fascinating. Lots of people were telling me, and what you going to do? Just going to be, what do you think? People will come and pay to you just to listen their stories. And that was very much mindset that you can go and share your story with whoever you want. Share with friends, share with family, they'll help you. Yes, of course, it's good to open and to share and speak with others. But the trouble is that very much when you go to someone who is specialized in this, they will give you the right advices and they will know what it is about. Lots of people were telling me, even up until now, that this is only for people who really struggle or really had... I mean, once you already hit the ground, let's say, then you need that. But this is why I'm telling that lots of things you change in my vision as well. And I was always thinking that having someone to go and to share and to speak give you so much more freedom and, I don't know how to say, happiness in your life. Because otherwise we just put everything into us and at some point it will explode. Either it's going to be illness, either will be something mentally we're going to get, I don't know what I would say.
Because the reactions can be really different, can't they? Really different, because it might be going quiet, it might be getting angry, it might be, I don't know, like eating a lot or not eating a lot. It might be hiding away or not going out. It might be trying to be like the biggest person in the room all the time in terms of like being really outgoing. People react so differently all the time, and it's sometimes hard to understand why people react in a certain way.
And the thing is that people don't want to understand that this is helpful. It's not just you go and you lay down somewhere and you just talk and they just take your money and that's it. That was the mentality all the time. And when you say as well, referring a bit more to back in the time, nobody doesn't take this thing serious. And I'm not surprised that obviously a bit more West Europe, USA, they are much more open to that. And this is helping them. And as I always was querying before we sat down and had an actual conversation with a coach who explained us, because I was a bit not sure why the world is full of coaches for everything. But these are the little moments that we can't carry on everything on our own. These are the moments that we need to ask, I wouldn't say help, but to find time for ourselves and to help us with the different things. Either it's a coaching for something or either to look after our mentality a bit more. So it's obviously Bulgaria really still is coming. I would say probably East Europe is still probably starting, but it's incredible how you're working with so many people all around. And have you got people coming back, or how long is taking? How is called? It's not like you work with them.
Yeah,
yes.
like
how long is taking?
Well, it depends, because people I work with, therapy, it's part of their cover. They have like a package at work, and the sessions are paid by their employer. And when they come, they have, for example, 8 sessions, 12 sessions, 10 sessions, but then they can continue and they pay out of pocket. And this is how it works with me. I always try to, if they come with a specific demand, it's like they have a symptom or specific objective that may be work related or something more personal, we try to work on it. And then very often they discover that psychotherapy, it's actually an exploratory work, and they think, oh, now I'm starting to understand myself better. I'm starting to get clarity. It's all about clarity, this getting access to the bigger picture. I like to call it like this. And they continue. And with some people, I work for years, like 3, 4, 5 years. With one person, we had like 400 sessions. And then I stopped him because I thought, you're so amazing right now. Just go and help people. He's a CEO of a very big company, is his own company. And I said to him, now stop. So sometimes people stay. It all depends. It's also, I want to highlight that it's a very expensive service in the United Kingdom, and not everyone is able to pay for private therapy. And this is a factor that actually stops people from continuing. And people I work with, so this package, these sessions, they renew every year. So we make sure that actually we spread them over the year, or they use them, then they come back. But once they start, most people don't stop, because they see how powerful it is. And it's not only, and I think, Meri, it's something that also you just said, it's not only working on specific mental health issues or symptoms. It's all about being happy. It's all about getting to know yourself. Most people don't know who they are. They don't know anything about their defense mechanisms, about their reactions. As Rich said, they don't understand their own reactions, and therefore they don't understand people's reactions. And when it starts to become clear, then they think it's so beneficial. I'm myself doing therapy every week. It's been like this for the last 20 years. And I can't stop. I can't.
Yeah, but do you know this, what you said now, that once people start to know them a bit more, I'm really curious, are they coming to you and saying that the people around them start to see them different? because I think people start to not understanding. Once you start to have a bigger picture for yourself, and you're starting to learn yourself and to know much more, and you start to express much more what you like, what you don't like, what you want to do. Some people who've been around you, they start to question that, and they start to think that you are changed not for good. How is that?
That's all true, Meri. That's also true. And you know why? Because very often people who do therapy, they start to set up boundaries. They start to say no. They start to be self-assertive. And of course, people around them don't like it. And they start to make them feel guilty. Or they think, no, this needs to stop. And very often my patients tell me, oh, my mom told me that it's because of your therapist. She's not good. I can hear this so often. And that's because they are changing boundaries. It's a very central, important concept. Once you start to set up boundaries, people around you are unhappy. Because
it changes, doesn't it? It changes so much, Ivanka, because like people go from being submissive, like, so for example, and I guess an example would be in a marriage, like a male and a female, where maybe the male is much more dominant, maybe at some point, but then if the lady is building her confidence, becomes more assertive, then it changes over. So it goes from he's really powerful and controlling, and then it becomes the other way, because the lady then can turn it around and use her positivity to control things the other way. And then the other person starts to get submissive. And it's a very difficult balance in relationships between two people. It's one of the hardest balances to keep that relationship and the friend, because the friendship obviously has to be the key between two people. And it's the same within families, because families and people get upset that there's like jealousy.
Yeah, but that should be everywhere. Friendship everywhere, with friends, even the connection at work. I think exactly this is the balance, that it's everywhere in different areas. And it's difficult. And I remember, I think I was talking to you and we said something about exactly that. When you start to change, people start to, probably some will leave, and they're not gonna like to be around you, but I'm pretty sure you attract more the ones that like yourself as you like yourself.
Absolutely. Some people leave, but also you leave some people, because psychology, it's all about understanding how other people impact you, how other people's behaviors impact you. And then you see the toxic behaviors, and then you think, maybe I have been accepting these toxic behaviors for a long time because of fear of being abandoned or fear of not being loved. But now I'm starting to love myself, and maybe I don't need these people in my life. And usually I notice it's very universal. When we live our lives and we focus on others, this person will not like me, this person will not love me. And when people start therapy, they revert the process, and they start to think, maybe I don't like this person at all, maybe I don't need them. And sometimes boundaries can be very extreme. It's like, no, I don't want these people in my life. And it's a very central moment to your life. It's about yourselves. It's about ourselves. It's not about others. And we waste so much time focusing on others, which again comes from childhood, because we learn from a very young age that we need to be a good girl or a good boy to please our parents. It's about the parents. It's not about us. Especially in Eastern Europe. Maybe Rich, you can tell us more about England, but and it was at the time post-communist time where, you need to be a good girl, a good boy, and you need to please others. It's like it's all about others, so we learn to pay attention to others and then to not put ourselves first. I think it's cultural, and no one is able to escape. When they start to do therapy, yes, but not before.
And it's interesting you talk about counselling, and I can imagine you mentioned earlier about, like, for example, with the CEO. So obviously, if you're in a very strong leadership role and you're getting positive counseling on how to deal with every situation, it gives that person even more power in their workplace, even more confidence to be able to deal with the situation. And they have they will have, when, for example, what you do, you're obviously training them in all the different ways to be able to be strong in a situation, to drive people, to motivate people. And that is the same not only in a business relationship, but it's also the same in a family relationship, and building that strength. And there's always someone who's going to be weaker. And obviously people talk today more recently about narcissism and about the effects of narcissism and how people then control people. And then it's a very delicate balance, isn't it, I think? And it's really interesting.
You're making a really good point. I want to add something. Sometimes people, for example, a partner or colleagues, they are willing to work on themselves, but sometimes they are very resistant, and you can't influence how people will behave with you. You can try, but then you have no control on people. However, you can focus on understanding and influencing yourself, your reactions, and this is where you have control. Then we can't control people, and even if we know all the theories, and even if we are so motivated to improve our relationship, whether it's personal or professional, if the other person doesn't want to work on themselves, it's impossible. And very often people, they come and, they're motivated and they think, now my relationship is going to improve because they have the keys, and they're so disappointed when their partner doesn't want to participate. They don't want to change. So we need to work on ourselves, but also we need to accept that we can't control other people's behaviors, and sometimes we're going to fail not because of us, but because of others. And we need to accept failure. We need to work on acceptance more than only learning coping strategies and change. I think they come, hand in hand, acceptance and then change. They are together.
Is there like a quick advice or something that in few sentences you can tell us about when we talk about how we try always, probably we grew like that to please others. And when it comes a moment that we need to say no, and we can see that someone is not happy with our reaction, or you can see that people was exactly when we talk about, we start to please everyone and we start to put ourselves on first place, let's say. How can we get over the guilt that we feel? Is there something that in just few sentences you can advise people?
So guilt is the deepest and most difficult feeling to deal with. So the advice I can give is try to extract yourself, which means that distance yourself from this person who triggers you and who makes you feel guilty. And once you extract yourself, you will be able to see the situation from a different angle. And after you do that, ask yourself, my behavior, what I do, is it fair? And then, does it align with my values? Is it okay in general? Not whether it is okay for the person, because it's one person making you feel guilty and giving you negative feedback, but is it okay in general? And does it align with my values? Because if I do, I behave well, I'm honest, I'm sincere, I'm respectful, I do things right, maybe this person has a problem and they need to deal with their own emotions. So extracting yourself, first step, stepping back to be able to look at the situation from a different angle. And then this question, is my behavior okay in general? And that's a Buddhist principle. That's not even clinical psychology. It's a very old principle. What I do, it needs to be fair, and it needs to be something good for society, for others in general, not for one person.
Interesting.
We stop our story in France, but there is a quite good things coming to you after France. So tell us about your coming in UK and how this happened in your life.
Yes, when I graduated, it was a few months before I defend it. It is called the Viva, I think, in English. The doctorate or
a PhD. It's a doctor of philosophy. Yeah.
Yes, the PhD. I realized that actually France was too small for me. I thought, wow, I'm very limited because, I did so much in 3 years. I was able to teach students, to teach medical doctors, and it's very difficult to teach medical doctors in France because there is, I'm an MD, I'm a doctor, and then you may be a doctor, but you're a PhD. So there is a gap, and I can't trust you. MDs are the best. And then, you're a psychologist, and if you have a master's degree, like you're so small. And I thought these people, believe me, they offered me to go write papers with them, papers that were published. And I thought, okay, I'm teaching my clinical work. It's amazing. And I start to get recognition by some people. But then I'm very limited because I'm not a medical doctor. So I get recognition because I help them build their CVs, but I don't get recognition for me. And then I can't really build my private practice because it's very difficult. I can try, but it's difficult. And then I thought, I've heard of King's College London. So King's College London, when it comes to psychology and research in the medical field, it's one of the top universities in the world. And I thought, I'm going to go there and I'm going to work for King's College London. I'm going to continue my research career because the PhD, it's a research doctorate. So I was also doing because of the fellowship, but PhD, it's research. And then I'm going to also build my private practice. And that was the plan. I left everything. I became a French citizen. And Fabienne, my friend I mentioned, she's a nurse still. She's a nurse. She helped me a lot with that. And I became a French citizen, even if most French people don't consider me as being a French woman because of the Eastern European accent. Then British people, they like my Eastern European accent. I like it too. But anyway, so I thought I'm going to leave the country, and I left everything. I sold all my furniture. I was living in like a small studio, but very beautiful one. I'm leaving everything. I'm taking my cat and 16 at the time boxes of books. And then when I moved from the UK to Bulgaria, there were 90 boxes of books. So at the time, so 2015, and they're all here. I can show you. I don't know whether you will see them. Now you see a little bit,
a little bit.
A little library.
Yeah.
A little library.
Yeah. So I thought, I'm moving to England. I'm leaving everything. I'm taking my cat, my books, and we're moving to England. And then everybody said to me, you're crazy. That's not okay. You're a psychologist. You're supposed to be a serious woman and to take good decisions. That's not okay because you're a French citizen now. I was about to buy a flat, to get a mortgage. And then they said, but there is this amazing career and in front of you. But it wasn't amazing. I was not seeing myself being in Nice and developing my career because for me, I had developed enough of it. So I moved.
Just one thing on this point. What drives you at that time to be so determined and so much to know where you need to go and that you are going? There is no plan B. This is your way. How you build this? Where this come from?
It's ambition. I have always been very ambitious. I'm very ambitious right now. And sometimes I'm thinking, is it a good thing? Then I think, yes, it is. Ambition. But also I'm very realistic because if you think how psychology is organized in France and then you compare to London, it's a very quick decision, very realistic, quick decision. And also I thought King's College London, if I don't do it now, when am I going to do it? In a few years' time, maybe I'm going to be married with kids. This has never happened. But, I was thinking, I'm not going. That's
a brave decision, because you build your life in another country. You already get your status. People know you. You've got your workplace. And now you leave again everything, and you move not in another town. You just move another country. So that is a brave decision. And did you had anyone in UK back in the time, or it was just you? You pack your stuff and you go in UK?
Yes, it's a brave decision, but not the first one, because I have already left Bulgaria, Meri, and it was an amazing decision to leave everything. And I knew that leaving everything, it's such a powerful thing for me. And then I did it again in 2021. And knowing me, maybe I'm going to do it again. Yeah. I don't know.
Next interview from US.
Absolutely. But then, let's see. But then my sister was living in London at the time, and she helped me massively. She helped me a lot. And I think that without her, things would have been very difficult and very different. So very grateful to my sister. At the time, she was living with her fiance and some other people. And she said to me, I'm going to keep a room in the shared house for you. They helped me, because moving my cat from France to the UK was so difficult. That was actually the most stressful thing for me. Not me moving, but moving my cat. Unfortunately, she passed away in 2022, my best friend for 13 years. And then my sister helped me with the cat, because they needed to come to Calais and to take me with the cat. That was a very, and then we lost the cat once in London. The cat, I thought, I'm going to let her go in the garden. And then she disappeared. And my neighbors, the English neighbor, he didn't know me. And the guy was searching for the cat with me for 3 days. And he found the cat. So that's another story with my cat. But yes, my sister massively helped me. And I think that without her, maybe it would not have been possible, if I need to be honest. So that's a massive help. And then there is another story to it. I thought it's very difficult, actually, when you live in another country, to look for a job, actually. So living in France, to look for a job in London. So I thought, I'm going to go there. And I think I'm going to put 2 months. That was my deadline to find a job. And I found 2 jobs in a month and a half. And I had 5 interviews aligned that I needed to cancel, because of the first job that was offered to me was at Guy's Hospital, an amazing research job. And then 2 hours after Guy's called me, I have a call from King's College London. So I thought, Guy's Hospital, they are so nice, but I want King's. And then I called the lady at Guy's, and I said to her, and the lady at Guy's Hospital, she liked me so much, so she created a second role for me, because she said to me, actually, there was another candidate that was better than you, because they have experience in the UK. And it was like knowing the law and having experience, something that I didn't have. But she said, but we had funding and we liked you so much. So we decided to create the role for you. And then I said to them, sorry, guys, there is King's College London calling me. And the lady said, you're amazing. I'm so sorry, because you're amazing, but I wish you best of luck. So amazing lady that you go to an interview in a new country. And my English at the time, it's like I had a great understanding, but I couldn't speak. So I prepared very well. And I think that it was clear, that it was new and difficult. And to imagine people like me, and instead of it being stressful, this lady creates a role for me. And then I say no. I still feel guilty for that, because she was fantastic. Really fantastic.
Ivanka, do you find like you're obviously in France. Obviously, you said how difficult it was initially to adapt, and obviously particularly the hierarchy between the different people. So like you obviously that all the different doctors at the clinics, and all the people in surgery. So all the people around you. Do you think it's more open in the UK? Are people more open to and more encouraging? Do you think that's a way? Is that why? Because obviously you just talked, as you explained then, about with the lady at Guy's Hospital, and she was very understanding that your target was really to go to King's, and once the offer came, that it doesn't matter almost, she could have offered you the top job in the country, like at Guy's, but it would, what you were looking for, and you kept that focus, but the understanding was there. Did you find that easier compared to where it was in France?
Absolutely, definitely. And here maybe I'm not going to talk about England, but about London, because I get a different feedback. For example, Manchester or even smaller towns, but definitely. And also, it's so interesting that in Bulgaria, people say to me, you have an accent. It's very bizarre the way you're praising your words, etc. In France, it's again, you have a very small accent, which means like your accent is awful all the time. And in London, no one so far has ever said to me, you have an accent, and obviously I have an accent. No one is interested in that. And to answer your question regarding hierarchy, when you have a doctoral title, people call you doctor with respect. All my patients from the US, from Canada, from Hong Kong, I work with a lot of people from China, from India. It's a doctoral title and they respect you. And very often when they write me emails, they call me doctor. No one has ever called me a doctor in France or even in Bulgaria, but in Bulgaria it's different. People don't understand it. And in the United Kingdom, it's recognized. You're a doctor, and no matter where you're coming from, your nationality, your religion, your accent, your face, people respect you, and they know that you can help them, and it's fantastic. That's why I keep my business in London, and I'm growing my business in London because I feel recognized, I feel acknowledged, but also people help me recognize myself. It's fantastic. It's really fantastic.
Most probably the diversity in London, because you've got so many people from different nationalities, and they just get used and they start. And it is great to hear that. Tell us a bit more the experience, what King's College gave you, because obviously you get your goal, you achieve your goal. What was to walk on your first day at King's College?
It was fantastic. I worked with fantastic people and it was like a dream job. I had this amazing office because I worked for Anne-Marie Rafferty, and you can guys Google her. She's fantastic. She was the president of the Royal College of Nursing, a very big professor. She obtained the title Dame, from the Queen. And I was in her office, so actually benefiting from her office. And it was like I go there, I have my coffee, it's warm, it's Southbank, and I see National Theatre and, the river. It's all fantastic, like a dream job, and people were amazing. If I need to compare to France, in this hospital, but people say that in the NHS it's very similar, maybe some hospital-related thing. People talk a lot. Imagine like groups of people, like coalitions against each other. So if you like the other group, you don't like us. So it was so difficult as a dynamic. And I go to King's. Everyone is with their teas or coffees, and people are very reserved, but very kind. And they welcomed me, and I will never forget. So the first day at King's, there is this induction. It's very, I think, English thing, because I never had induction in France. And then they, all the new starters, I remember we were 5-6 people, and we met, it was, I think, not the president of King's, but sorry, I don't remember, like a very important professor, and they put us in front of a screen talking about King's and telling us, you need to be proud because you're part of King's. And I thought, no one has ever said to me that I need to be proud because, for example, I'm a psychologist or I work for this hospital. It was the opposite, making me feel uncomfortable or making me feel guilty. And now the first day, you need to be proud. You are one of the top performers. You need to be really proud. And I thought I like this narrative. So actually, King's gave me a lot, but also King's has contributed to me improving my self-esteem and my self-confidence because I learned to feel proud at King's College London. I learned, and they also said to us, 35% of our workforce are international people. We are proud that you're coming from all around the world to work for us. And I was able to feel it. It was not only a narrative or, something that we say to people on the first day at work. They were really proud of us, and never I felt different. I was feeling different in France every day. I feel different in Bulgaria. People say to you very weird things, but never I felt different at King's. Never I felt different in London. And I thought I can define myself as an European, but also as a Londoner. And if you ask me, where are you from? I can say I'm from Europe and I'm from London because I was feeling Londoner. It was really amazing. For the first time in my life, I felt proud and I thought I have achieved so much and I need to recognize it. Yeah,
do you know, Ivanka? I think that's one of the most important things when you're in any environment. If you've got someone who absolutely encourages you, who actually gives you the superpower to succeed, who actually lifts you up and to build that confidence. And there's so many, and that's where people find they thrive in those environments, because I think to be a successful person, to be able, you're inspired by the people around you. And I think it's one of the common themes we've had throughout the podcast we've been doing together with Meri. And you know what? All the people that we meet, and they've got these encouragement, and it's exactly what you said, because you came from quite a difficult environments in each case. You were getting encouragement in some ways, and obviously those steps. And we went through with a lady a few months back, and she was talking about the ladder of influence, and again this ladder of influence is affecting you. And when you went to King's and you had that great encouragement, and you've reached in many ways probably one of the pinnacle of medical excellence, to go to that university and to actually to be able to study and to work with the team, and it's obviously attached to the hospital, and it's you're able to do so much, and that makes such a difference in life, because then you really feel empowered to go to the next level, and that confidence then sets you up for the future. Wow, what a difference it makes in life.
I really love your story and this determination and passion to go and achieve the things. But is there anything that inspired you back in the time to start this way to go and because let's say if I talk about me very often, I mention my granddad because he was quite big inspiration for me. One of my cousin as well, she achieved lots of things in her life. So there are people or teachers and people I met they all inspire. Does anyone play that role of big inspiration for you to go and conquer this place, that place, to achieve? Or it was something self-driven?
Well, it's a mixture of both. Self-driven in a sense that when I was living in Bulgaria, people used to underestimate me, to reject me. I was not popular, and very often people were laughing at me or saying bad things, you're ugly, you're this or that. And I wanted to show them you're wrong. And I think for a long time, it was a great motivator. But once actually I started to work for CAMHS, things shifted because I thought, now I need to do it for myself, and I need to show to people. I need to teach people who are going through something difficult, or I want to share this knowledge to people. I want to become a role model to these people. Otherwise, all the psychoanalysts like Sigmund Freud, Jacques Lacan in France, but they are like big names. And even now, me talking to my therapist or to my astrologer, they often say to me, for you, it needs to be someone shining, like a big person, or someone who has achieved a lot. And even I mentioned this course that I'm doing right now. It's like marketing course. And the lady told me, because in the beginning, she wants to ask a lot about you. And she said to me, send me the 5 people you're currently following, like the top 5 people you're currently following on social media. And I sent these American gurus in psychology, and they said, yes, that's perfect for me. But she said, maybe it's not realistic because, that's a very high level. I said, yes, but you asked me to share what, and there is this idea with me, it needs to be shining. It needs to be Sigmund Freud, the father of psychoanalysis. And, but then I'm also inspired by other people. And to be very honest with you, I'm really happy that it's my very first podcast. And 2 months ago, when I reactivated the Facebook page, I said to myself, now I want to conquer the public space. I want people to hear me. And I'm really glad that you are my platform is the very first podcast, because I admire you. You're fantastic. And I thought these people are offering me the chance. And I'm really happy that it's you, not someone else. So you are inspiring me as well. So you see, it's a mixture of many factors, but it's all amazing. I just feel happiness, It's like I'm a little girl who wants to learn, who wants to read. And people at the time when I graduated and I got my master's, people said to me, oh, you will see in 5 years' time, you're going to be married with kids, you're going to stop reading. And not at all. Actually, I read every day. I'm like a little girl who wants to study, who wants to get to know other things, who wants to travel. And maybe I have a problem. I don't know, but it's just so fantastic. For me, it has never stopped. I see myself as this 5 years old, wanting to analyze people's behaviors. And for me, it becomes bigger and bigger. And the ambition becomes bigger as well. And people don't understand me. People judge me a lot, and which is fine. But it's, people think you're very weird, and that's not normal. You will be 40 years old in 3 months, and you spend your time reading books, and I love it. And they can talk, and it doesn't matter.
But it's interesting, because I think that's when you're that kind of person and you're driven and you have that drive, and it doesn't matter, you always want to learn. And so many people, they just want to get to it's like coming up to a retirement age, and everyone's they say, oh, when I get to, I don't know, like 60 or 65, I'm going to retire. I'm going to stop work. I'm going to stop everything. I'm going to sit on a beach, or I'm going to go on a boat, and I'm going to travel the world, and then, but it all happens. But somehow we need that motivation. We need something exciting. We're always looking for the next level of excitement in life. And if your vibe is to be entrepreneurial, if it's to learn, you never want to stop, because you get to one level and you think, well, actually, I've got to there. I wonder, that's an interesting area. Or this is an interesting area, and I think that changes us and gives us a real strength. And often, I mean, we talk about it. Surrounding ourselves with like-minded people. And when you've got the like-minded people, you get that drive, and you can actually thrive on that situation, and it takes you to a next level. And those people who are around you, encouraging you, they don't want to draw you back. They want to push you to the next level too. So and then if you're surrounded by the same people, you push each other up, and you just keep going and going and going. And that's the most wonderful experience. and other people, like you just said as well, Ivanka, is like, some people always like try and hold you back. Oh, you can't do that. Or what makes you think you can do that? What makes you so special? Yeah, but it's not about, I'm not special. It's not that we're not special people.
You are very special people. I'm interrupting you. You are very special people. Sorry, Richard. You are very special people.
But we just have a way, we have a way and a passion for life and a passion for moving things in a way that we want it to go. And if you can follow that journey, and you've done it exactly the same, Ivanka, you said, well, you said to your father, well, I want to learn French. I want to go to France. You're in France and you got to that level. I want to go to King's College in London. And that's where you went and you pushed. And then you got to that level where you think, right, okay, well, I've got my qualifications, I've got my doctorate, I've got all the things I wanted to do. Actually, do you know what? I like London, but I actually want to be in Bulgaria now because, I want to support my father and give something back. So you decided to do that, and however long that stays, and you don't know, but this I'm sure there's something else bubbling around inside of Ivanka going, this is the next journey, because this is what we want to do next.
Absolutely, you're absolutely right, and I know that. And people also tell me that one day I'm going to die with a book, just reading a book, and I'm sure that it's going to be something like this. And we are all different, and it comes to values. Because for some people, maybe building a family, for some women being a mom, it's their values and it makes them happy. But for me, it's like more and more and more. I want to be a mom as well. I want to have an amazing family, but I have this ambition, the career, my business that I'm developing. I'm just like that. I want it all. And then, people get scared when they listen to me talking. Some people, but this is me, and that's me. That's my values. I'm aligned with my values, and this is how it's going to be. It's my life, and I really feel happy.
Mm-hmm.
If you go back in the time, is there any advice you would give to your younger self? Something different, or from today's perspective, what advice you would give?
Well, I'm not going to change anything, and I'm really happy with my younger self. However, I was quite bullied in high school, and and then being quiet, maybe, I could tell my younger self, open your mouth, because right now, no one will do this for me. They can try, but they feel the energy, so they're very kind. So maybe that's the advice. Be brave when it comes to people, defend yourself, because I built this confidence in France and then I validated it in England. But when I was in Bulgaria, I was the shy girl, dealing with depression, lots of depression and anxiety, sometimes having these dark thoughts, and because I believe this narrative, that was the wrong narrative. And I would say to my younger self, don't believe people's narratives, build your own narrative. That's the only advice. But to be honest with you, Meri, I'm not going to change anything. And I'm happy. I'm very proud of my younger self.
I think you should be proud. Yes, this definitely is a journey. Yeah. This is exactly journey for Meet Your Inspiration podcast, because you can be a clear inspiration for lots of people to leave your place on that age, go in another country, achieve, not just go and finish university and go back, to achieve such a high level, and then to pack everything, as we said, go in UK, and not to work wherever, to work in King's College, where is the top of the top. This is a great achievement and deserve a really big shout out. And it is a great example. This is why we want here to share the big examples. And obviously back in 2016, I didn't know that I met such a great, inspiring and amazing lady, but here it is. Yeah. In 2024/2025. Life is different and we never know all these great people that we meet around us. So it's all good. What are the next steps at the moment? What is your, obviously to develop a little bit more your business?
Yeah, absolutely. Right now, I'm studying marketing because in 2016, I started to build this community, and I built an amazing community. You're part of it. You met a lot of the other people. But then, to be honest with you, I didn't know what I was doing. It was posting and meeting with great people. And now I thought I'm going to do it differently. And I work with this amazing woman. Her name is Dorina, and she teaches me marketing. And the course is called How to Build a Brand. And now I'm building my brand. It's Dr. Ivanka Ezhova. It's me. And I'm developing social media in Bulgarian. I'm going to do it in English as well, which will be my main business. But it's very difficult to do both because I'm learning, and I take this Bulgarian social media as a test. Like I'm practicing the skills because you know very well it's very difficult in the first place, the camera and to talk and this big eye watching you. And then people leaving these comments and they're thinking, oh my gosh, what's that comment? And then deleting the comments because I did well, but then I'm thinking, okay, but that's not the message. So I'm going to develop it in English as well. And then the lady told me, but you need to find a topic because you talk about everything, and you need to find a topic. And since January, I've been working with an amazing therapist because all my life I've been doing therapy. I believe in therapy myself. Her name is Amelia Deneva, and she's the daughter of my astrologer, the big role model for me right now. So everything is super linked. So my astrologer name is Paula Deneva. Amazing people that I recommend as well. And then with Amelia, so since January, we've been digging into my deepest traumas. And I know my traumas. I know what they are, but then looking at them from a very different angle, super deep, I thought that's so interesting. And I decided to build my project around childhood trauma. Because if you ask me, what is the most interesting topic for you right now? It's a very clear answer to me. Maybe in 5 years' time, it's going to be a different topic. But right now, it's childhood trauma. I have a lot of experience because the cancer center also, I work with many lawyers and who have clients who have got a road traffic accident. And I can say that I'm an expert in that, and I feel confident, to say out loud, I'm an expert and I can help people. So I'm developing this project. It's a lot of work because it's visuals. I want to create a podcast one day, and that will be amazing. I want to take part even on TV, and the ambition is here. So it's a very big project. So that's the plan for now. And also in the meantime, I'm still having my private practice. My private practice, it's a comfort zone. It's something that you do with closed eyes but it's a comfort zone. It's so perfect, so fantastic. So I thought I need to move out of this comfort zone. And you will not believe me, God sends me the best people. My patients are just angels. They are so amazing, but it's very comfortable. And I want something
law of attraction, Dr. Ivanka.
Yeah.
It's law of attraction.
I agree.
Attract. Oh, it's great. And I'm pretty sure you'll achieve everything. And we will, obviously, we will check on you more often. But who knows, maybe in a year time, you can come and share with us. Where are you? And what's going on? Because this is the other important things that we are trying to keep with our guests. With obviously, yes, some are a bit more far away because of distance, some are a bit more closer. But yeah, we want to have our lovely network and to keep informed what's going on with our guests, because each of them are bringing really inspiration to us, and they're another example to show us that everything is possible, isn't it, Rich?
Absolutely. Yeah. I mean, it's interesting because we were talking just about learning, and obviously you were talking, Ivanka, about reading. And one of the things Meri herself sort of talks about a few times is this, and I think it affects everybody today, is this, obviously we were talking about social media and marketing and growing, and it's a very fine balance between the learning and growing, and also encouragement around others, and encouraging people to learn, but also other people around us who are learning, to encourage them. And there's this balance on, we were talking about it, about social media, and about the fact that we love encouraging other people. So you support people. So if you're going to encourage people through social media, you tend to sort of look at it and you're liking it and you're encouraging people and you're making comments. Now, obviously that has an ability to grow your personal profile, but maybe for us, maybe it's not about growing our personal profile. It's more about being encouragers and helping and supporting each other. But it's interesting because we then become more hungry to learn more. And it's easy actually to read. I mean, we end up saying, I don't know how...
But we need more than 24 hours. We don't have time to read.
No, Ivanka, you're saying the same thing, because obviously you've got an incredible core of incredible clients who you absolutely love and adore, and you're helping them, and I'm sure they love talking to you and sharing. But you've also got this next level that you're going to go. But it's amazing. We can't always sort of do everything, and it's a very interesting balance on how we leave a legacy behind us in each situation. And almost sometimes one of the things, because we try and do it all ourselves, and sometimes I think it's a fine balance on how we grow ourselves into a team of people that maybe can do the same thing. So you leave those footprints behind you and other people who can then follow in that footsteps and do the same work. And I think if we can all, we're talking about inspiration, and you said earlier about a common theme, and I know one of the things that people talk to us about, when you have a podcast, you must have a theme. Now, obviously, with inspiration, it can cover anything. You can inspire people at every point of their life, and also the journey that they've had. It's always different, and we're talking about today's psychology and the mind, and how we're affected by trauma and difficulty, and even we could talk about like the psychology of social media, for example, or marketing, or clinical, and it's the subject just never stops. And I'm sure we could have this podcast for the next 15 hours, and we still wouldn't cover half of the things we need to cover. And I'm sure there'll be a million questions we could cover. But it's a fascinating thing. But the one thing that we all can do is to encourage one another, to support one another, to try and do our best to understand one another. And if we can do that, then that's a huge thing. And I think you've shown that today in everything you've been through with this, Ivanka. Really have.
Oh, thank you very much. I agree with you completely. And then if people align with your values are super important, then they will connect to you. And that's the case for us. And then for other people, there will be other values or no values. And this is life. And for me, it's so important to get inspired, to get in touch with people like me, people who share this ambition, people who like to learn, who love to connect to other people, who love to talk. And it's fantastic. It makes me feel happy. It's meaningful for me, because life is about meaning, not just talking to people or pretending we are having a conversation, but having a deep conversation and connecting to each other, which is the case for us, and it's meaningful. I'm always looking for this meaning, and for me, if life is not meaningful, then I need to change it. Or if some interactions or a friendship or a relationship is not meaningful, then I need to let people go. I learned to do that, and it has been amazing. Sometimes we need to let go, we need to change.
That's going to be something we need to discuss next time. I'll be very intrigued into how we let go the things. Quickly, if anyone want to contact you, which platforms they can find you on?
So for the time being, my platforms are in Bulgaria, but I can leave a Gmail and people and a phone number that you can share with people, and then they can contact me there.
Okay. That's fine. That sounds good. Thank you very much for this lovely conversation. And this is definitely we'll have continue because it's interesting. Most probably we didn't even cover everything on your journey, but we will go back to that again. And yes, thank you very much. We wish you a great year ahead. Keep the ambition, because I think ambition is a great thing and people need to have goals to wake up every morning and to try and go and achieve. So yeah, all the best, stronger and determined as now, and we'll check on you later on.
Yeah. Ivanka, thank you.
No, thank you so much. And if I can add something, the ambition keeps me. It's not the other way around. And next time we continue, and Meri, I would like to interview you next time. We are going to change places, and I really love to do that because you're amazing. I'm sure that you have a lot to say, and you need someone to guide you, to ask you the good questions, and I think that I can be this person. I really want to interview you next time, and thank you so much. All the best with the podcast as well. You're amazing. It's amazing, and we're going to see each other and talk to each other very soon, I feel.
For sure. Thank
Ivanka,
you.
Thank you. So, everyone who's listening, we hope you really enjoyed today's episode with Ivanka. From me, Meri, and Ivanka, we'd like to say thank you. If you're watching on YouTube, please give us a like if you've enjoyed the episode, and we ask that you would subscribe to the channel. And if you're listening on Spotify, again, please do follow us on Spotify. We thank you very much, and we hope you have an absolutely amazing and fabulous week and day ahead. Take care. Thank you. Bye-bye.